Welcome back. It's a good thing to welcome our next guest. This is Dr. Tiffany Beck, and she's a gynecological, you know what, this is the wrong way to say this. She is a gynecologic oncologist, and so she's going to tell us a little bit about her practice today. She's from Hoag Hospital and will let us know everything that we need to know about this very important issue. Good morning, Dr. Beck.
Good morning. Thank you so much for having me on.
Ken and I both got the name of the profession wrong. So it's gynecologic oncologist.
Gynecologic oncologist. Yes, it takes some practice.
It does, it does. But you're here today to tell us about gynecologic cancer and about the five major types of cancer that we can look for.
Yes. So as a GYN oncologist, which is another way to
GYN?
say that,
I like it.
It's a little bit easier for people. What we do is we treat women's cancers, so cancers of the female reproductive tract, and there are five main types: cervix, uterine, ovary, vulva, and vagina. And so those are the cancers that most commonly affect women in their 50s and 60s or later on in life. And September is GYN Cancer Awareness Month, so we're trying to raise awareness about the signs and symptoms to look for these cancers.
And that's why you're here with us today, doctor, and thank you for that. Tell me, what are some of the signs and symptoms that you could begin to look for?
Well, one of the most common symptoms for the most common type of cancer that we treat, endometrial cancer, is bleeding after menopause. So even a little bit of bleeding after you've gone through menopause is not normal and should prompt you to see your general doctor and to have an evaluation. And that's the most common symptom for that type of cancer. It can also be a common presenting symptom for cervix cancer or even vulva or vaginal cancer.
My goodness. And is there a sensation or a pain or anything like that that you could also watch for?
For those types of cancers, there can be some discomfort, some abnormal discharge, or some itching. The abnormal sensation tends to come more as a sign of ovary cancer, which tends to be a little bit sneakier than our other cancers, in that it doesn't have a bleeding or a discharge often associated with it. It may just be that you're feeling full sooner after you eat, that you noticed your clothes aren't fitting quite normally, or your belly is feeling a little bit bigger, you're feeling more tired. And so a lot of these signs are signs that people may attribute just to getting older.
Sure.
But they may start to have some discomfort or some trouble with their bodily functions, like bowel movements may not be quite normal. And when those things start to add up, you might just not feel like yourself, and those are other reasons to mention those things to your doctor. How would you
be able to discern? Because it does sound like just getting older, to have a body that changes shape and your belly gets a little bigger and you get a little more tired. What would maybe spark you to understand that this could be something different?
You know, in general, when we talk to our patients, it tends to just be a sensation that something isn't right. It's sort of everything together. I'm feeling so much more tired, and my belly is getting bigger, my pant size has changed. All of those things kind of together, just saying, and trying not to ignore that and pushing that to the back of your mind. There isn't one big red flag that I can say for that, which is why most ovary cancers tend to be diagnosed in later stages, and that they don't really have that whole constellation of symptoms until they tend to be more advanced.
What are the treatment options for some of these cancers, or for these five kinds, and what are some of the detection options that we have?
Well, treatment options vary depending on the cancer type, but in general, for things like ovary cancer, it's a combination of surgery and chemotherapy. And most of the time, we start with surgery for ovary cancer, but occasionally we do start with chemotherapy to shrink tumors down before doing surgery. But either way, it's going to be a combination of those treatments to try to get people into a remission. For other types of cancer, surgery is often involved as well, although there may be a combination of surgery with or without chemotherapy, and sometimes we even work with our radiation oncologist for radiation as part of the therapy, depending on the cancer type.
And with some ovarian cancers, you wouldn't even notice a difference in size or shape of your body at all.
Yes, that's true. Ovary cancer is a very big category, and there are lots of types of ovary cancer that fall into that. And so that's true. Sometimes it's just something that gets picked up on your well woman exam is abnormality or a mass, or you're getting an evaluation for something else and they notice an abnormal ovary, and then we evaluate that. But the most common type of ovarian cancer does tend to present with that bloating and feeling full earlier after meals and that tiredness.
Now, Hoag is a COEMIG designated facility. Can you tell us what that means?
Yeah, so it's a center of excellence for minimally invasive surgery, and so what we try to do for the surgery part of the care of our patients, whenever possible, we try to use a minimally invasive approach to promote earlier recovery, faster recovery, and still be able to give people an adequate surgery. And so we use the robotic platform a lot of the time to be able to achieve those minimally invasive surgeries and get people home very quickly and recovering and back to themselves faster.
It's so fascinating to hear about robotic techniques for surgeries. Can you tell me a little bit more about those techniques?
Yes, so robotics is sort of a fancy way of doing laparoscopy. So what we do is we use a camera through a small incision to look inside the abdomen and the pelvis, and then we have some other small incisions that allow us to insert instruments, and then we attach that to a robot that gives us the ability to move the instruments like you would move your hands.
Yes.
And so that lets us get really up close, it lets us have very careful dissection, and but being able to do all of that through those small incisions.
That's amazing. And the robot, it increases the accuracy?
It increases our ability to be able to see things up very close. And
the robot is the camera then. It's really more of the investigative part of the
Right,
the surgery.
it's the machine that attaches to the camera and the instruments and then allows us to control those instruments through the robot itself. So it allows you to have much more range of motion than traditional laparoscopy would,
Yes.
and to be able to get up and have a 3D view so that you can see the pelvis more accurately and take a close look at what you're doing.
It's fascinating. It's beautiful. I'm so glad that Hoag is offering this kind of technology, and also glad that September is Gynecologic Cancer Awareness Month. So what should they know and what can they know during this awareness month?
Yeah, so in being aware of your body, I think, is probably one of the most important things. If you're feeling like something's not right, talking to your doctor about it, but also making sure that you're up to date on all of your screening, making sure that you've had your mammograms when you need them, but also making sure that you're up to date with your pap smears. And that has been a moving target, how frequently women need pap smears and what type of tests go along with that.
Yes.
So just making sure you talk with your doctor and say, am I up to date? Is there anything else that I need from a women's health standpoint? Getting your annual exams and talking to your doctor about any symptoms that are new or different, especially something like bleeding or that bloating or feeling full, those types of things.
And when you say that a pap smear is like a moving target, is there a range? Because the decision on how many pap smears you need in a year or in a span of time, that changes.
Yes, and it used to be very easy. You went to the doctor every year, you got a pap smear every year.
Yeah, once a year.
And that was very, very easy for people to remember. But now we've incorporated HPV testing along with pap smears, and that is a really sensitive way of determining people's risk of having abnormalities down the road if their pap smear is normal now. HPV is a virus that is the most common cause of cervical cancer.
Wow.
And so if you, it's very, very common and very easy for people to contract, kind of like the flu. Almost everybody gets the flu. Almost everybody who's sexually active also gets exposed to HPV at some point in their life. And so testing for HPV as part of the pap smear lets your doctor know sort of what your risk is of developing an abnormality down the road. So there are some guidelines now to say whether or not you've had HPV testing with your pap smear changes when your next pap smear is due.
Oh, that's interesting. And then would your general practitioner be able to guide you in any way? I know that when you see your OBGYN, of course, you can get all of the answers, but what can we learn from our general practitioners in this respect?
Yes, absolutely. And so there's the ASCCP, which is our guidelines on Pap smears, puts out these guidelines regularly and has a website to help practitioners and general practitioners who do women's health care, in addition to general gynecologists, so that they can be most up to date. And that way, every time you come in, if there's been a change in the guidelines, they can look and see when your last Pap smear was, whether it included HPV testing, and then make a recommendation for you at that time. So while you may not need a Pap smear every year, it's still a very good idea to see your doctor every year and ask, am I up to date on my Pap smear? Do I need one now?
You know, it is such a great thing to set up all of your scans, your testing every single year for everything, and to see the doctor every single year. But let's say you are diagnosed and you do have HPV or the proclivity to have that. What's your next step?
There's really clear guidelines for that too. So some of that depends on whether or not you have an abnormality on your Pap smear in addition to having HPV, and your provider can guide you as to whether or not there's anything to do or whether or not you might just clear that HPV virus on your own. Our immune system does a really great job of clearing HPV for most people.
Wow.
So it's only a small percentage of people that will develop an abnormality of the cervix because of that HPV, but we're really viewing this as a preventable disease. If you've got that abnormality, we sort of follow you a little more closely. We may recommend a procedure to remove those HPV infected cells, and that just make sure that close follow-up, that hopefully that doesn't become a problem for you down the road, because it takes some time for HPV to cause cancer of the cervix.
Well, all of this is wonderful news, because you could become extremely frightened if you are diagnosed and you have the proclivity, or you do have you're inclined toward HPV, and you could be very frightened about that, thinking, oh, now this is it, what do I do next? But you said that our immune system is so good that HPV could be cleared up by our very own immune systems.
It can, absolutely, and some of that is dependent a little bit on age, so the guidelines do change based on age, but for a lot of people, they'll clear the virus over the course of maybe 2 years.
Wow.
And so we just have some closer follow-up that happens in that time period to see whether you're clearing it or whether we need to do something to help get rid of those HPV-infected cells before they cause a problem.
And are sometimes those HPV-infected cells cleared by a medicine, or is it usually a procedure?
It's usually a procedure. If that's persisting, or we're noticing changes in the cervix, precancerous changes of the cervix, or even very early stage cancer, a lot of times we can remove that portion, and that's all that someone might need. Whereas when unfortunately, the most common situation when people are diagnosed with cervix cancer that's more advanced is that they haven't had those visits, they haven't had those annual checkups, and so that has had time to get bigger and to cause a bigger problem.
Yes.
And then in that case, they may need more treatment than just removal of those early cells.
Oh, Dr. Beck, it is so good to hear from you today, because this is so important, and this is the month. September is the month to be aware of cancer, of OBGYN, of gynecologic cancers, and to set those appointments. If you haven't been to have your Pap smear, your mammogram, this is the month to be aware and to call and to set up your appointments for your tests and your scans.
Absolutely, yes.
Well, Doctor, thank you for being here with us. We always welcome Hoag. You're our good neighbor, and it's so good to have you here and to be aware of this September month.
Thank you so much for having me on.
Yes, thank you. And thank you for being with us. I will be right back after this.